Triple P, Positive Parenting Program, is an early intervention strategy which benefits both the parent and social worker, offering a range of programs covering the entire population from birth to 16 years old. Through this presentation, I will discuss the significance of this parenting program as it relates to child maltreatment, the program's specific strategies and methodologies, and an assessment of its uses in society. The Triple P program, which stands for Positive Parenting Program, is very important for everyday parents, helping them to become better parents in a safe and fun environment. Triple P provides parents with simple and practical strategies to help them confidently manage their child's behavior and, most importantly, prevent problems that could develop. In today's world, adults are becoming parents without truly knowing how to properly rear their children. This program is of interest because of its simple program and how it has been shown by documented research that it works among many different socioeconomic groups, cultures, and different family structures. Triple P addresses how to treat as well as prevent behavioral and emotional problems in children and teenagers. Prevention is key to this program. If we prevent social and behavioral problems in the family, school, and community before they arise, we can create family environments that encourage children to become good citizens with emotionally healthy futures. The problem begins with unprepared parents. Many parents have children without the proper guidance and skills to deal with behavioral and emotional problems. Triple P equips parents with the skills and confidence they need to be self-sufficient and to manage their family with support and wisdom. Triple P also focuses attention on early intervention, support to prevent child abuse, mental illness, and antisocial behavior. Sometimes parents are unable to make the right decisions for their children for a myriad of reasons. Parents need support. This is where social workers and the appropriate departments step up to aid and assist in bringing the family together as a positive unit. The social worker should provide assistance to improve the social and psychological functioning of children and their families, and to maximize the family well-being and the academic functioning of children. The Triple P program is flexible and works for parents, practitioners, and communities. With training, it can be easily taught to the social workers within the population for use within the community. The training is condensed into a series of workshops to reduce time away from the training. It is either 2 or 3 days only, mixing videos with group discussions and rehearsals of interventions. The training itself is evidence-based and continually evaluated from feedback from the participants. Triple P is built on a self-regulatory approach which recognizes each worker's strengths and practices. The amount of child fatalities per day attributed to child maltreatment is appalling. Children are suffering from an epidemic of child abuse and neglect. The United States Department of Health states that every year more than 3 million reports of child abuse are made in the U.S., involving more than 6 million children. The United States has one of the worst records among industrialized nations, losing on average between 4 and 7 children every day to child abuse and neglect. As the graph from the U.S. Government Accountability Office shows, the number of child fatalities per day recorded has been on the upward trend since 2010. And in 2012, there were an estimated 4.5 fatalities per day. And these are only estimates. The more we assist this generation, the better the chances of this nation producing good fruit, figuratively and literally. When children get caught up in the system, this will also cause society to pay more in taxes to support the downtrodden. On a broad scale, as an early intervention strategy, Triple P can reduce costs associated with conduct disorder, child abuse, and out-of-home placements, showing benefits when compared to the cost of the program. The Triple P program has designed a population approach to parenting. It aims to reach as many people as possible to have the greatest impact on the population as a whole. It can go to scale simply and cost effectively, and has been tested in population-scaled studies. It has shown to work with many different cultures and ethnicities. The Triple P Positive Parenting Program isn't a single program, but rather a group of interventions of increasing power for parents of children from birth up until 16 years old. Within each level, there is also a choice of delivery methods. This ensures Triple P is flexible enough to meet the needs of the individual. It gives each parent as much help as they need, but not too much, to prevent over-servicing and encourage self-sufficiency, hence the motto, for every parent.
Hello, I'm Dr. Dennis Embry. I'm a prevention scientist and a child and developmental psychologist. Everywhere I go, parents, teachers, business leaders, civic leaders ask, what can we do about the rising rates of ADHD, conduct disorders, depression, and other problems facing our children today? Until recently, there was no clear answer to that question. Then, in 2002, the U.S. Centers for Disease Control funded the first population-level study to test the impact of providing practical parenting supports to every family with children 0 to 9. Dr. Ronald Prince, professor of psychology here at the University of South Carolina, is one of the principal investigators of the CDC study.
This study produced two major findings that we're very pleased with and that we think can make a difference. First, we were able to reduce the number of children in foster care placements. Why is that important? Foster care placement disrupts children's lives and families, but it also costs the community a lot of money to maintain those kinds of placements. We were able to reduce that. Secondly, we were able to reduce injuries, child injuries that resulted in hospital or emergency room treatment. And that was another way to cut down on the unfortunate consequences of family issues that have gone awry. And we were able to reduce that.
What is Triple P?
It's an acronym. It's our positive parenting program, but it's a resource. It's something that we have in our toolbox.
Triple P is a system of parenting information designed to help parents manage children in healthy, positive ways.
Triple P means support for every parent. That there is always something that as a parent you can learn in many, many different ways. And Triple P is a way for that kind of information and support to be a natural, everyday part of your world as a parent.
Governments and families provide medical vaccines to protect our children from common childhood diseases such as mumps and measles. Triple P is a behavioral vaccine that parents and governments can offer to protect our children from common and costly difficulties such as ADHD, conduct disorders, exposure to violence, and other problems. And it cost less than those medical vaccines.
We have parents who, they're really fed up. They're upset. They don't know what to do. They tell you, I'm trying, but I'm not sure what to do. And when we can bring them the knowledge from the Triple P program, you see that it calms some of their anxiety. They feel good because, okay, I can try that.
Level 1 is called the Universal Triple P because it reaches the broad section of the population with parenting information and messages. This level is not delivered directly to parents. The motto of Universal Triple P is, "Stay positive." This is a communications campaign which includes brochures, posters, articles, billboards, which aim to put parenting on the public agenda in the community to raise awareness of the need to support our future and present parents. The program aims to help parents feel comfortable asking for parenting help, encourage parents to participate in positive parenting interventions, and increase the reach of their programs while counter anti-parent, parents blaming messages in the media, and most importantly, help parents become more confident and self-sufficient in their parenting. Level 2 of the program is an intervention, which provides brief assistance to parents who are generally coping well with their children, but have a few, 1 or 2 concerns about their child's behavior or development. Level 2 is available for parents of children who are newborn up to 12 years old, and also for teenagers. This program can be delivered as a seminar series or primary care from a social worker. The seminar series is called the Triple P Selected Seminar Series and introduces parents to positive parenting in 3 different 90-minute seminars. Seminars are entitled Power of Positive Parenting, Raising Confident, Competent Children, and Raising Resilient Children. There is also a Teen Triple P Seminar Series. Take-home sheets help the parents recall important information learned in the seminars. The alternative approach is via a brief primary care method. The program is delivered by social workers who provide regular support to parents of children and teenagers. A brief one-on-one consultation of 15 to 30 minutes targets the specific issues that the parent had addressed as concerns. Follow-up visits may be needed. Level 3 consists of targeted counseling for parents of children with moderate behavioral difficulties. Interventions that deal with a specific problem are also available for both young children and teenagers. This intervention level is delivered via primary care or discussion groups. Primary care Triple P includes brief face-to-face or telephone intervention with a social worker from areas such as child and community health, education, allied health, child's care. It lasts around 15 and 30 minutes. Tip sheets and positive parenting booklet reinforce established strategies. The Triple P discussion groups involve 2-hour small group sessions targeting a specific problem, behavior, or concern. There are 4 topics for parents of younger children entitled Dealing with Disobedience, Managing Fighting and Aggression, Developing Good Bedtime Routines, and Hassle-Free Shopping with Children, and 4 topics for teenagers in Triple P discussion groups. Level 4 of the program focuses on parents of children with severe behavioral difficulties or parents interested in learning more about the program. This portion covers Triple P's 17 core positive parenting skills that can be adapted to a wide range of situations. This level of intervention is delivered in group sessions of 12 or less parents or in private individual counseling for those who need intense support. The group sessions are supported with 3 catch-up sessions at home, and the standard Triple P or individual counseling is delivered over 10 one-hour-long sessions with DVDs. There is also an 8-session web-based program called Triple P Online that guides parents through the 17 core principles. Self-directed Triple P is another option, which includes a 10-week program based on a workbook. Additional help is provided by 15 to 30 minutes of telephone conversations. The final level of the program, Level 5, involves support for the entire family of children with serious problems. Parents must complete the previous level in order to be eligible for Level 5 instruction. Level 5 intervention materials are delivered by the Enhanced Triple P Program or Pathways Triple P. The Enhanced Triple P Program is for parents who have a complicated family situation. They may have issue with their domestic partner, outside stress, or mental health issues. This level focuses on working on partner relationships and communication, personal coping strategies for high stress, or other positive parenting practices. Pathways Triple P is for parents at risk of maltreatment. This level is extremely important for this course as it covers anger management and other strategies to improve the parent's ability to cope with rearing children. Prevention is key. Triple P also includes some programs that are additional and specific to certain issues facing the parents of a population. Stepping Stones Triple P works with parents who take care of children with disabilities. Family Transitions helps parents who have undergone a separation or divorce. Lifestyle Triple P works with parents of overweight children. Indigenous Triple P helps elders in remote or urban indigenous communities. Triple P Positive Parenting Program is beneficial in that it spans across nationalities, cultures, and backgrounds. It allows customization to the parent who needs help. There are many different ways the program can reach its audience, by way of personal consultations, phone interviews, sessions in person or online, or group sessions. Unfortunately, these can only help a parent who truly wants help. The parent has to have the initiative to enter into these programs and listen to their advice. The portion of the program in Level 1 that focuses on campaigning seems pointless at first glance, but it is valuable. Parents have to increase their confidence and recognize that babies do not come with manuals. Asking for help is okay. Learning how to cope with stress and how to manage their children is key to preventing child maltreatment in the future. The methodology focuses on different levels of intervention. These levels are valuable in that they are simple for the social worker to use in their assessment of the practice needed. They are helpful for the parent so that a logical, comprehensive game plan can be made. The Triple P program is promoted as an evidence-based intervention. However, I would like to bring into question the bias that exists among most of the articles featuring this intervention. Most of the articles are written by Dr. Matt Sanders, who is the person from the University of Queensland who developed the Triple P program and is very involved in the materials, promotion, and training. Recently, more articles have been published questioning Triple P's methodologies. Dr. Philip Wilson published in BMC Medicine an article questioning the program. His study found that while some mothers generally reported Triple P was better than having no intervention, there is concern over high risk of bias, poor reporting, and conflicts of interest. They found no convincing evidence that Triple P interventions work across the whole population or that any benefits are long-term. In a different paper, Dr. Coyne commented that there were substantial problems in the quality of evidence provided. Dr. Coyne mentions that Triple P presents a problem with underpowered trials that are susceptible to risk of bias and manipulation of results. Triple P is currently used in 25 countries around the world and is implemented to individuals, educational institutions, county, state, and national governments. The program is used on newborns to 12-year-olds and has separate programs for teenagers. There have been more than 250 published papers, including more than 140 clinical trials evaluating Triple P. Evaluation is obviously built into the program since it is constantly reviewed by parents and social workers. The founder himself provides population trials and more research dedicated to seeing prevention work for positive parenting. It is important for a parenting program to actually have results in the population. For social workers, the program includes simple questionnaires. These tools allow workers to monitor before and after results. A computerized scoring application makes the results easier to access. The questionnaires address family functioning and behavior. On a larger scale, the scoring application can be made to apply to the entire region for statistical analysis. Triple P is already implemented in Palm Beach County, and it is evident why. It can provide parental assistance to families in their home in both English and Spanish. The Center for Family Services of Palm Beach County quotes a testimonial on their website stating that Triple P has helped my child and me immensely, showing that it is already proved beneficial in our community. Currently offered seminars are posted on the Palm Beach County website. In addition, child-focused organizations such as Urban Youth Impact in West Palm Beach could and would benefit from this program. Urban Youth Impact focuses on at-risk youth in a community filled with violence, gang members, and child maltreatment. These parents are in great need of instruction and guidance from the Triple P program. They would benefit from the campaigns that would heighten their ability to ask for help. These youth show many behavior and social concerns, and the parents do not know how to deal with them many times. Triple P would be of great help to these parents, and the organization could help implement it. This is Robert Powell. Stay classy, Palm Beach County.